Hello, everybody. Welcome. I am so happy to have with me today my guest, Lindsey Wismer. So, Lindsey and I know each other because she was in the first cohort, we were just talking about this, of my professional SIBO training course. And recently, she popped back in because she just had something she wanted to talk about. And while she was there, she told me this incredible story of her own healing of SIBO with probiotics. And so it just blew me away. It's so incredible. That is why I wanted to have you as a guest to tell your story. Let me just explain Lindsey's background. She's a nurse practitioner and she has dual board certification in adult and women's health. She's primary care provider, but focuses really on functional medicine and lifestyle focus and has a few specialties: menopause, metabolic health and weight management, and of course, SIBO, IBS, and GI conditions. She practices in the same town where I am, Portland, Oregon, at Merit Health and Wellness. And that's Merit with two R's and two T's. And the website is merithw.com. And I'll link this in the description. Okay, so Lindsey, will you please tell us about your story? We had talked about your SIBO case because it was tough. So tell us about what was going on and what made you decide to try probiotics. And we're going to get into specifics, of course.
Yeah, I have a long history. And first of all, thank you for having me because I firmly believe that if there's one person out there suffering that hears this story that wants to give this a go, it's worth it. And they can share that story with somebody else. Long story short, probably over a little bit over a decade of suffering from SIBO symptoms and having chronic relapsing SIBO. Hydrogen subtype predominantly. I was sometimes a little positive on methane and constipation subtype. I didn't have a name for it for probably the first 3 years of my suffering of symptoms. I was working with like a functional chiropractor that had a nutritional business in Portland. And I reached out to him after everyone told me it was just stress. I got every runaround from the ER physician to gynecologist to primary care. At one point, I thought I maybe had ovarian cancer because of the bloating, like all the things that everyone thinks of when they don't know how to put a name to a diagnosis. And somewhere along the lines, I can't remember now, I heard this term SIBO, and I actually ordered a breath test through the naturopathic college myself and then interpreted it with another professional. But it was Dr. Shaver, who I think you know pretty well.
Oh, yeah.
With her for a while, and she's the first person who kind of guided me through some treatments. And it was not shortly after that, a few years later, I took your course, but I had a difficult journey. I followed many of the protocols. I think I first heard you speak at an NUNM SIBO event, maybe back in, I don't know, 2016, 2017 or something.
I think we started in 2014.
Yeah. I was probably one of those first ones in that conference room. And like many, was very hesitant to use traditional antibiotics to treat my case, whether it was me sometimes self-treating or working with a provider, as I often did to treat. And I really was geared towards herbal antimicrobials. And I used all of the protocols multiple times for relapses. My go-to was probably neem and alamed. Spent a lot of money on that in my years. And I also have probably done elemental diet maybe probably 3 or 4 times throughout the decade. It wasn't my favorite just because it was isolating and hard and all the things, but I even made my own at one point instead of the physician's elemental that I usually used. I did rifaximin. That was definitely a go-to for me when I could access it. Either I think I had some prescriptions from brand name here or from some of the more foreign sites that I had to have delivered through a Canadian pharmacy. I used that in conjunction with neomycin a few times. And between all of those therapies, I would get relief. I would repeat my test because I was very much a person who liked to get that test and then repeat it. And occasionally I would go based off symptoms, you know, how we always talk about the 90% relieved of the most distressing symptoms, to quote you probably. And I did that a lot, but I also tested a lot because it was very helpful for me to see those gas levels go down. And they would, and I would follow the SIBO biphasic diet, or I dabbled in low FODMAP and different things. And those were hard. Obviously, they're socially challenging, they're isolating, but I did my best I could. And without a doubt, I would sometimes go 3 months without symptoms, sometimes a month, sometimes 6 months, and it would always come back. And my hallmark was bloating. Like I would just get bloated, whether it was 2 or 3 hours after a meal, or sometimes it was even within like 15 minutes. And I really think that was a immune response trigger or something like that, because the food wasn't obviously in my small intestine totally then. Very limited diet for a number of years. Hard to stick with that. I've always been gluten-free since I started having gut symptoms. That was like the first thing I did when gluten-free was kind of new evolving term for it was hard to tell a waiter at a restaurant you were gluten-free, but now it's so easy in Portland, especially. So yeah, I suffered, long story short, for a long time. And it was not until, do you want me to share how kind of I decided to fall on these probiotics?
Yeah, thank you for the history. Yeah, so because you had a circumstance coming in your life. Oh, and also what was happening was now you were getting to a point where these remedies weren't working anymore.
Yes, and I was frustrated. I went through, I think it was the early parts of the pandemic, and that was actually easy to do an elemental diet during some of those times when people were like isolating and at home. But all of a sudden, I had a relapse after I did an elemental diet, and I went to my traditional antimicrobials, and I was always taking a prokinetic, always taking like 1,000 milligrams of magnesium oxide, always trying to be aware.
For constipation, just for
Yes, for constipation. Don't do that if you're the opposite of me.
yeah, for magnesium for constipation. Yeah,
Yes.
prokinetic for everybody with SIBO.
Yes, and I would take both. And I actually had just gotten married and went on my honeymoon to Italy. Obviously, a place that's pretty carb heavy, pretty wine heavy, even all the gluten-free carbs that are still sometimes problematic for SIBO patients. And I decided I was going to treat myself over there with rifaximin because I usually was able to eat with more freedom when I was on treatment. And so I did that, and the rifaximin just wasn't helping. And I could just tell it was just not how it had been every other time before. And this might have been my fourth or fifth time on rifaximin, or Xifaxan, or however you want to say it. And I used to also take that once in a while just to help reduce risk of relapse, sometimes when I was traveling. And I was like, what the heck? And it was frustrating because I was on my honeymoon and I dealt with the symptoms, and it didn't take away from my fun experience on that vacation because I was so used to it. But I was like, I kind of got back and I was like, I got to do something different. And this was the summer of 2022. And I knew that my husband and I wanted to try to get pregnant eventually. I knew that I had lab markers that showed not good things as far as fertility goes. I was already in my late 30s. I had listened to Dr. Stephanie Hayes. I'm not sure if you're familiar with
Oh
her, but
yeah.
I
Yeah.
listened to a podcast. Maybe you did it with her, or Dr. Jacoby, if I'm pronouncing her name right. Is it Jacoby?
Yeah.
Um, and I listened to a podcast and it kind of scared me. It was like, you know what? I'm in my late 30s. I've got major history of chronic relapsing SIBO that was also autoimmune positive from the IBS smart test. I don't know totally what my root cause is. I think it's probably food poisoning.
I was wondering if you knew,
I think so. I think it's probably food. I don't remember the food poisoning episode, but it's the only thing that makes sense for me because I never had any abdominal surgeries. I never had trauma to the abdomen, didn't have endometriosis or scarring or anything like
yeah,
that.
and just for everybody who's listening, your case that you presented were chronic relapsing, and now things aren't starting to work. This is sometimes something we see with people who have SIBO from food poisoning. And the IBS Smart test is what can let you know that if it's positive. And just to have hope, Dr. Pimentel is working on a cure for that. And we are really hoping in not too many years from now, we'll have a cure for this underlying cause of SIBO. So,
Yeah. And it's amazing. And you kind of sit with that test that's positive and you think, gosh, this is going to be my life. This is going to be my life. And I always try to encourage any of my patients with chronic conditions that this is a part of you. And you might have symptoms, but it doesn't mean you always have to be suffering. And it's a part of you. And it doesn't mean it's going to be your whole world, but it does feel like your whole world when you're feeling sick. And so I was our family has a little bit of a lake cabin down in Lincoln City. And I was on a walk with the dog and I was listening to another podcast with the owner and creator of Microbiome Probiotics. I'm going to butcher his name, but Kieran, I can't remember.
I think people pronounce it both ways, Kiran Krishnan or Kiran Krishnan.
Yes. And
Microbiome
so
Labs. Yeah.
Microbiome Labs, and I list randomly. I probably screenshotted something on my phone that was like, oh, I want to listen to this podcast. Went on a walk with the dog. It was him, and I can't even remember who the person he was talking to about. And he was talking about SIBO, and he's like, he just had this idea about what he termed a three-prong approach to treating overgrown bacteria that's problematic. And I was just listening to it. And I don't even remember the details of the podcast. It was a short one. It was like 30 minutes. And I kind of just had this moment where I was like, I'm totally scared to try probiotics. I've always been scared to try probiotics. Like all the other ones that we've kind of mentioned, the SIBO world and stuff, I was always just hesitant because I was like, probiotics equals bloating. Inulin equals bloating. Chicory root fiber equals bloating. Like, no, I won't even touch kombucha, like those kinds of things. And I just said, I'm grasping at straws here. I just didn't respond to rifaximin. I've done endless bottles of neem and alamed, and I didn't want to spend one more cent on herbal antimicrobials. I'd spent thousands of dollars, thousands on my SIBO treatment for over a decade. Time, effort, and so much money, like so many people do, which is one of the biggest things I prep people for who've got a long SIBO journey. And so I had just heard about this Microbiome Labs probiotic, and I think probably from a speaker or presentation, and he explained spore-based probiotics so well. I was like, I'm gonna try it. What do I have to lose? And I'm not usually that daredevil with my health, but I was like, it felt daredevil-y in the moment. And I went home and ordered them on Fullscript and just got him sent to my house. And I remembered what he said. I reviewed the podcast a couple times, and he said something about just layering things in. And he said, take two of one of the types of probiotics at breakfast, two at lunch, and two at dinner. And watch out for die off, watch out for bloating. And I was like, okay, and he explained the Mega IgG product to use for die off. And I said,
Actually, let's stop here for a second and let's say two things. So, what were the three probiotics? We'll just say them right now.
it was HU58,
Okay, so I've got them all here. I can show
yep,
you. Here's this
which is
one
a single strain probiotic, a Bacillus subtilis, and then is the formal name. And then it was a Megaspore biotic.
right here,
Yep. And Restore Flora.
like this. And now I don't want to stop your flow
Yep.
here. This is really
Fine.
good. But let's just give everyone the end is that, which we did in the beginning, which is that it worked.
It works.
Okay,
Yeah,
so now let's go back to the story.
it works. So I didn't have children yet. My husband and I were just enjoying summer, and it was like, okay, I'm going to do this. And the really appealing thing to me about HU58 that he emphasized in this random podcast I listened to was that it had like 22 different types of antibiotic compounds, meaning it helped like an antibiotic would. And that really struck me as like, okay, this feels safe for me to try. And so I started with that and I titrated up. And I think that's a key that I did was I think I probably took half a capsule of HU58 at one meal on day one. And I assessed my response. And was I bloated? Yes, I was. And I mentally was like, keep going. Like just keep going with it. Trust the process. Trust what your intuition is saying. And so I think the next day it was probably every day or every other day I added a little bit more. And I got up to two caps of HU58 over probably a week. And then I moved to probably Megaspore or Restore Flora and added that in at lunch. And so I'd be on, for example, two caps of HU58 at breakfast. And then I started with half a cap of Megaspore Biotic at lunch, worked that up to two capsules per day over the course of maybe, I don't know, a week and a half. And then I added in probably Restore Flora or vice versa. I'm not sure if I did Restore Flora first or last. And so eventually, after probably a month up titration, I was taking two HU58, two Megaspore, and then two Restore Flora, all in the same day, but two of each at each meal. And I didn't necessarily have to be eating food with it. I could also take it if I was having a light lunch or occasionally would skip a meal for the day if I was busy. I was bloated. I was absolutely bloated. And I just thought of it like a bell curve because I knew I had been bloated with die-off from herbal antimicrobials and not as much with rifaximin, but I knew what bloating felt like. I knew what die-off felt like. And it wasn't the same type of die-off. It wasn't the same type of die-off where the herbal antimicrobials would sometimes give me like joint pain, almost achiness, like flu-like symptoms, just complete lethargic feeling, plus the bloating. It was more constipation was a little bit worse and bloating was a little bit worse, my hallmark symptoms.
Right.
And
And that is kind of a classic thing
uh-huh,
for die off, as
uh-huh.
we talk about.
Yep. And if it got distressing, I just knew to go slower. And I tell my patients that all the time that you don't have to go up at the pace that I went up or that someone else went up. If you want to try this, you might be someone who's doing a quarter of a capsule every other day if your body's really sensitive, and it might take you 3 months to get all the way up to two capsules of each per day.
Mm.
And so you have to base it on what you feel comfortable with. Can you get through your workday or childcare or whatever you have to do in your day with the bloating that you might be having initially? And so I
Now,
kind of gauge that.
earlier you mentioned Mega IgG. You want to show that? You have it?
I do
Mhm.
have it right here.
Okay. And I know you told me you were able to use this to help assist in your bloating, which is amazing. So tell us about that.
So that was the other piece of the puzzle, is that I had tools. I already knew a lot of the die-off tools, whether it was, breaks between eating or hydration or things like that. But I had heard him talk about mega IgG on this podcast. And so I was like, I'll try it. It sounds like it binds up toxins and things that are causing this inflammatory immune response and pulls them out. I've described it to my patients like Pac-Man, just kind of buzzing around and eating up some of that byproduct and die off and pulling it through the liver and lymphatic tissue and out of your body. So I tried it, and I tried like 2 capsules per day or per dose, and the full dose is like 4 at one time. And it was honestly like an immediate, let's call it an immediate Advil or immediate Gas X for me, where
Wow.
I call it Advil for the gut to my patients. I'm not a proponent of just popping Advil like Skittles, but most people in general population know that Advil reduces maybe an inflammatory ache or pain. If you sprain your ankle, you can take some Advil and get the swelling down pretty quickly. I would take eventually 2 to 4 mega IgG, and all of a sudden my bloating would start to get better almost within minutes.
Wow.
It
So
would like
that's just
that capsule would break
astonishing.
down. It would absorb, and all of a sudden it wasn't perfect, but I am a person who is so sensitive to bloating. I know exactly what it feels like. I have to explain it to some patients. Are you just full from eating a lot, or are you bloated? Did your stomach puff up like you were 6 months pregnant immediately, or do your pants just fit because you ate a lot, right? Fit tightly because you ate a lot. And so I felt like an immediate response from it. And so, being someone who suffered from constipation, there can be a side effect of constipation with this product. So I was a little scared and had to be very careful about basically taking anywhere from 2 to 4 caps, I don't know, 2 to 4 times per day was what I was doing in this initial phase to help me. And I kind of just was pretty intuitive with my body. So I didn't have to do some set dose. And I tell my patients that too. And that's something that I think people who aren't practitioners and haven't worked in this world like I have sometimes struggle with, is I had to give them a definite number, like take 4 caps twice per day, because the fluidity is sometimes overwhelming to people of like, oh, you can take it 3 times a day, you can take it 5, you can take 2, you can take 4. So I was using that as my kind of crutch to help with die-off, and it helped. And
Amazing. That's amazing.
I would
Now, I
say,
have to say, since you told me this, I tried it for myself. For anyone who's listening who doesn't know, I've had SIBO since I was 5 and pretty well managed, but I still do get symptoms and I have relapses and things. And I didn't find that it physically relieved the swelling, the bloating for me. But I know we're going to get into this more later, but I know you've tried this whole thing with other people. Have you seen the IgG help relieve other people's bloating?
yes, not everybody, but absolutely. And
Amazing.
I have a lot of patients who kind of just have it in their medicine cabinet as their tool. If they're maybe having like this upcoming week, a lot of people maybe overeat some sweets or candies, or we're getting into holiday season, and sometimes their gut just feels like a big bubble all of a sudden after maybe not being able to avoid the right foods, quote unquote, for their SIBO condition. And I'll say, just take some, just take a little bit, get home from that meal that gave you some upset, and pop 3 to 4 and see how it does. And a lot of people tell me it really helps or reduces inflammation.
Amazing. Okay, now, how long did you need to do this treatment until you got relief? Because where you're at now is amazing.
Yeah.
So tell us about
I
the
did it for
timing.
probably about 6 months.
Okay.
Probably about 6 months. And I wanted to make sure. I eventually was trying to get pregnant with my husband, and went and did start some IVF and things like that we had planned on. And I wanted to make sure it was safe to do through that, which it was. And so it was about 6 months. And 6 months, when you're thinking about 3 probiotics that are high quality, and everybody's definition of expense is different because we all have different incomes. But for a lot of just general middle income folks or lower income folks, it can feel like a lot to take 3 probiotics plus mega IgG for 6 months. And it was. And so that's also something that's challenging to relay to patients, is like, we have to kind of be ready that this is still going to be a little bit of expense, just like your other herbal antimicrobials were. But I was like, I'm just going to keep trying this until, and eventually my symptoms were a lot better. And I just kept going with it because I kind of just wanted to build this foundation. I was kind of scared to stop. And then I gradually, probably after those 6 months, just started gradually weaning off of the Restore Flora and the HU58, and ended up just taking the Megaspore. And by that time, I also was just using this, the Mega IgG, as kind of a as needed. If I would have a meal that felt really, ugh, I was so bloated after that meal, and it wasn't quite like a full SIBO flare. I just felt kind of yucky after a meal.
Yeah.
And so I'd take that. And then what I did was swap the Mega IgG for this, which is Mega Mucosa. And so I call this like the next step after this one because Mega Mucosa, this guy here, my screen is a little blurred, has a little bit of globulins in it, but also bioflavonoids and amino acids. And that's more to repair the gut lining as such, essentially, instead of just binding those byproducts toxins to pull. So it was kind of this rebuilding phase I was working towards. So at this point, maybe several months after that initial 6 month period, I was taking 2 Megaspore religiously every day, whatever meal I could remember it at, and probably 4 to 6 Mega Mucosa capsules each day. And I probably did the Mega Mucosa for several months and then pulled back on that as well.
And did
Um,
you eventually stop the Megaspore?
no, I've taken Megaspore continually for the past 3 years now. So let's say so this is summer 2022. I started it. And so, yeah, just over 3 years. And I don't take 2 caps every day. I probably take 1 cap per day and sometimes two. Like this season of life where I'm a new mom of a second baby and I'm not as well slept, which can affect my immune system and certainly affect my gut health and just getting adjusted to having 2 kids under two. I'm taking a little bit more support right now because I know that when I'm stressed or when I'm rushing or maybe not chewing and digesting as well as I should be in this busy season, I'm more vulnerable for having a SIBO relapse. So right now, I'm aware of what my lifestyle is like right now to take 2 Megaspore. I've added back actually the Mega Mucosa in this season of my life, and I take Mega IgG if I feel a little gut bubble.
Right.
So
So this is the other phenomenal news is that
I,
you got pregnant, you had your first child, and I know then you did at some point have a relapse. We can talk about that. And then now you've just had your second child. So huge congratulations.
yeah, and I'm almost 42. So if anyone is listening to this that has struggled with SIBO and IBS and is maybe in a geriatric age for pregnancy or seeking that. I'm not to say that like healing SIBO and having I won't even say I'm healed. I always know it's there. Not suffering as much from it anymore, let's say, and improving my gut health. I'm not going to say it's exactly what led me to getting pregnant because I know that infertility has many different realms and stories. But I firmly believe that the improvement and not constantly feeling bloated and inability to digest food probably helped my egg quality and helped my ability to have a hormone cycle that allowed me to get pregnant.
Okay,
So,
so I'm just going to summarize. So you did 258 probiotic at breakfast, 2 Megaspore at lunch, and 2 Restore Flora at dinner. You used IgG anywhere from 2 to 4 caps, 2 to 4 times a day as needed for bloating. And you did that for about 6 months. It sounds like before 6 months, you were having a lot of symptom relief, maybe like 4 or 5 months or something like
yeah,
that.
I was probably within 2 months. I was definitely noticing I just wasn't as reactive. I slowly would try to increase my like food variety, and I was just kind of testing the waters slowly. And
Very good. Okay, and then
I
after
was
about 6 months, you stopped that, except you continued Megaspore, and now you switched IgG to Megamucosa. You did that for a few months. So Megaspore and Megamucosa for about maybe 3 months. Then you even stopped the Megamucosa, but you've continued the Megaspore. Okay, so and then this has helped you to be what percent symptom free would you say?
90,
Amazing.
my typical diet. Let's
And
say
and your
it's
diet expanded, right? And then you could
yes,
right.
and I have a pretty healthy diet. I've continually been gluten free, but I wasn't eating corn. I was hardly tolerating dairy. Both of those things are back in my life daily now. Wide variety of vegetables. There's no vegetable I can't eat.
Oh, that's amazing.
If I was to go
I mean,
binge,
even including onion and garlic?
yeah, oh yeah, I love onions. I put onions in everything.
I mean,
It's been,
that's incredible.
I know, and I definitely was reactive to those foods. It wasn't my hallmark food, but I was definitely reactive. Say I was really more problematic through my SIBO journey with like starches and things like apple, especially, or banana, any sugars, any like processed sugars, and then some of the vegetables here and there, too many Brussels sprouts or things like that. and certain types of dairy, but I've expanded my diet to where I'm just pretty much gluten-free. And then I'm conscious of things though. I'm certainly conscious of way too many raw cruciferous vegetables, or I tend to have a paleo-ish type diet, but I certainly eat legumes, I eat grains, I eat dairy daily, but I'm more of a heavy animal protein, fish, vegetables, fruits type of person, sweet
Okay,
potatoes.
that's extraordinary. So I just hope everybody listening is hearing this amazing result of total food expansion here in the diet. Okay, now I know that you said you did struggle with one relapse after your first child was born, and you did this again and it worked. So guide us through that.
Yeah, so anyway, I was on the end of this protocol, taking things kind of just one or two megaspore and feeling good. Was pregnant, and I was symptom free throughout pregnancy because I know some people can struggle with that. And I had my first daughter in January of 2024. And then I think it was probably about April or May, right when I went back to work, when life got really busy again. I was rushing more. I probably wasn't as mindful with chewing. I wasn't as mindful with just more parasympathetic state. I just, boom, one day I was just bloated again. And I was like, oh, like, no. And I knew, I do. I was like, my vagus nerve has probably been discombobulated. That migrating motor complex has stalled. And at this point, too, I should say, I was on prokinetics for a decade, every single night. They was like something I was so tied to, that and my magnesium. I had stopped both of those too. I think that's probably an important point, that me
Ah,
being a person who took a high dose of magnesium oxide for constipation, I can't take it now because it will throw me the other way.
it'll give you diarrhea. So
Yeah,
that's an amazing piece we didn't talk about. Nothing else, no other maintenance needed other than just continuing Megaspore.
I wouldn't live without my magnesium oxide when I was SIBO flaring. It was like, where is it? Is it in my bag? Is it make sure when I'm traveling with it? Yep.
Amazing. But
So,
now that, so did that come back?
so that I just felt more constipated, more bloated all of a sudden, and I went right back to this approach. I bought the things I needed really quick, and I didn't titrate them up as slowly. I kind of just knew what to do, and I knew it was okay with breastfeeding, and I basically just started it again. And with I didn't even retest. Within a couple weeks, I was feeling better.
Wow.
And
Like
just annoying.
two weeks ish.
Yes, 2, 3 weeks. And I
That's
was feeling better.
incredible.
But then I really had to be mindful and have some good self-talk about, hey, you can't keep rushing like this. You need to make sure you're not pumping for nursing, emailing, drinking water, and eating all at the same time, because that is not good for your sympathetic parasympathetic balance. And
Yeah.
I am not perfect at that. It's probably the thing I have to continually work on as a busy practitioner and now a mom. But it's always something that's on my mind, that I am most likely to relapse with SIBO if I start rushing. And you honestly are probably in my head a lot, because I know from your SIBO course, you had talked about rushing and how
Rushing.
rushing
Absolutely.
people flare, and it absolutely makes me flare. And so even in this season, when I have two kids now, I've been aware that some days when I'm rushing and I'm multitasking and my brain is just like, "Ah, I've got to do all the things," I literally can almost feel the nerve connection of my brain and my gut, and things like slowing down or starting to feel a little bit puffy, let's say. It's
Yep.
wild. But I think being a person that's experienced these symptoms, like you have in your experience for so much longer than I have, even, that we just kind of get that brain gut connection and we can feel it. We're sensitive to it.
Yeah. And so, just for those listening, hear about rushing. The idea is the sympathetic and parasympathetic nervous system. We know sympathetic, the classic thing is fight or flight. Flight is rushing.
Yeah.
And all of our migrating motor complex and our digestive processes occur during parasympathetic. So they get shut off when we're in a sympathetic mode, aka rushing. So migrating motor complex, all these things, we need to not be constantly in sympathetic for to allow them to happen.
Yeah.
Okay, so this is just an absolutely amazing story. So even a relapse was handled. So that's where you're at. You've just had another baby. You haven't
Yeah.
gone back to practice yet, so you're not rushing yet.
I'm mindful of what I'm going to do to make my lifestyle even smoother as I go back, and being aware that I have to take more time to pump and eat and not be just rushing home real quick and rushing through emails, and boundaries with how many patients I see. And I'm still right now taking Megaspore, like 1 or 2 caps per day, Mega Mucosa.
Because you added that back in because it's a bit of a sensitive
Yeah,
period.
I'll probably always be on, as long as it's available, I'll probably always take Megaspore. And I remember, again, I'm gonna butcher the name, Kieran. Let's call it, say Kieran. I remember also he said, and maybe some other podcast I listened to, where patients or people just often ask him, how long should I take this? And that's probably a big question I get from a lot of patients. And I'll say, what's your lifestyle like? Because I remember him saying that he takes these probiotics, not just because it's his company and he wants to sell products, because they help him. And I remember he said, I'm in airplanes, I'm in sterile hotels, I'm in sterile conference rooms, I don't live on farmland. And he's like, I'm in an environment where I'm not touching the earth a lot and don't have this like natural immune system response happening. Maybe when someone's sitting in the grass having lunch, or maybe they have a garden outside, or they're not always in these sterile washed environments like a perfectly clean hotel room or airplane, right? And so that struck me also, that that was a reason why he continues to take probiotics. And I'm in a phase where when life doesn't feel too stressed and I feel like I'm in a good rhythm, I'll back down. And when I know, like in this postpartum season, life is a little busier, I'm a little more discombobulated, I'm a little bit less slept or less well slept, I'll ramp things up. And that's something I really try to encourage patients to do who I've done this with, is you just have to be aware of the season of life that you're in. And some people flare with eczema, some people flare with migraines. SIBO sufferers flare from bloating or constipation or diarrhea when things get stressful. So we have to be aware that's our body's sign that we're doing too much. Pull back and maybe
Well,
start your supplements
this is
again.
the perfect segue. Tell us about you trying this exact protocol with your patients, with other people. Tell us about
Yeah.
it.
Yeah, and I still follow so many of your protocols that you have from your course, and I'm forever grateful for that. It's been such a tool and guide that I've used and has helped me in my clinical practice. And then when this happened for me, I was like, well, why don't I try it with some other folks? And so I would probably say that I have to assess the patient just like anything. There's an art of medicine, right? And if I have a patient who's highly anxious, maybe, I don't know, let's say a little bit of inattentive ADD, or they just feel really disorganized in their life, maybe they're raising three kids and also working, and there's just too much. I can't give them usually this, let's titrate you up for 6 capsules of this every single day. It's just too much. So I start a lot of people, and not even my people who are like overly anxious population, just some people who are wildly busy and maybe don't have enough funds to spend on all these supplements with the other expenses in life. I'll start them just on HU58 to start. And especially if they're constipation sufferers, but sometimes I'll do the diarrhea sufferer too. And I'll just start with HU58 and this guy, Mega IgG for the die off. And I'll say we're going to take 2 caps, titrate up slowly, however you need to 2 caps per day with the IgG as needed. Let's talk again in a month and we'll see how you're feeling. Basically, kind of how you have guided me of like, let's see how we're doing after one treatment. Are you 90% improved? Are you 50% improved? And then we'll meet and I'll usually say, let's go for another month. Sometimes they're feeling a lot better and they're scared to change anything up. So we'll go for another month. Or that person might say, I feel really good. I feel a lot better. And I'll say, great, let's keep you on this maybe another couple weeks or finish out the bottle and let's put on Megaspore. Or, and I don't always use Restore Flora. I actually probably use HU58 and Megaspore the most. And then sometimes if I think there's an issue with maybe SIFO, small intestine fungal overgrowth, which can overlap with SIBO, right? Or some candida issues that a lot of people also have, I'll layer in the Restore Flora.
And that's
Um,
because it has that Saccharomyces.
yeah, yeah. And I sometimes just intentionally leave it out because, like you've probably experienced with the people you've worked with, too much is overwhelming, and
Yeah.
overwhelm creates more risk for relapses. So I have to really assess what the patient can handle and really preface what they're going to experience and how long they might be on it. And if that's financially okay for them, if that works to, some people hate taking more than like 3 or 4 caps of something in a day. They won't do it. And so we have to assess that too, right? I'm perfectly fine if you told me I needed to take 20 capsules of something a day to get better, or 30 even, I would do it. But many people are not like that. 4 capsules is like, oh, I can't take that many more pills. And so you have to read that as a provider.
You were also telling me about assessing people kind of by their gas levels for SIBO with
Yeah.
deciding to do this.
Yes. Yes. I have hesitated to try this protocol that I've kind of just done experimentally on people who have really high gas levels. Let's say the 160, 200 that I've seen, or things like that. And high might be different to you because you've probably seen even more mild test results. So
No,
where
those are severe.
yeah, and I think that I think trying the HE58 for a couple of those folks has been too much on their system. There's just too much overgrowth happening, and that bloating might feel too scary or too reactive. And so I've typically done it for my more mild to moderate cases of patients who can understand maybe dosing something a couple times per day, needing to take the IgGs. And I've stuck with typically traditional antibiotics or herbal antimicrobials for my more severe cases, or for the highly sensitive patients that maybe have some mold issues going on. They're reactive to everything, the histamine response people, and I can eventually get them on probiotics. But just like with any SIBO case, we're kind of having to think about what is the best treatment for this person given how reactive their system is, right? Like the super reactive person, I don't want to throw them on neem and Alamed. I'm probably going to try to use neomycin rifaximin because it might be less die-off potential.
And for you, the mild, moderate cases are yours, and those are the ones deciding to do this treatment with. Is that by gas and symptoms, kind of? You're figuring that out? Okay.
Yeah.
And so for you, what's the mild, moderate range of gas for that type of person?
Let's say they were 60 for
Okay.
maybe hydrogen, something like that, where I'm going to typically do one or two treatments if I was going to use traditional or herbal antimicrobials to
Now
get
you'll try this
them
probiotic.
points. Yeah.
Okay. And
Um,
symptoms, as you described, not severe, not sensitive and reacting to everything. They're like, I think you were saying before, like, they're not suffering
yeah.
terribly. They have
There are
time to
people.
play with this.
Yes. Yeah,
Yeah.
and I have to assess that confidence that they're like, okay, let's try this, let's do this. And that's with everybody. But there are some people who are just living in a cage with SIBO. They can't eat anything. They're reactive to their entire environment. They're bloated all the time. And that's the person I might hesitate at first. What I'd actually do if that person did not want to do traditional antimicrobials or herbal antimicrobials and wanted to start probiotics, I'd probably put them on mega IgG, this guy, which I've done actually with a couple people now that I'm thinking of it and talking it through, just that for maybe a month or two before I baby step into some HU58 because I'm
And
kind
the
of clearing the debris essentially.
and that what amount would you do them on?
What amount of IgG?
Yeah.
I would just have them try it once in the day, two capsules maybe, see how they feel, and then titrate it up anywhere to maybe 3 to 4 times per day, 2 to 4 caps.
Okay, so pretty good amount there.
Yeah, and assessing are they constipation sufferer or should I add some magnesium oxide? And the way I've explained it is I'll tell people, let's come out of winter season and maybe you have a big garden in your backyard and we haven't touched that garden since August, right? And there's weeds and there's leaves and there's all sorts of things that are making your garden not look pretty. We're going to put the mega IgG on board, and that is basically someone coming like a landscaper to help clear out some of the debris, right? And get the yuck out. Or that's your assistant that's going to continue to help with die off by taking your debris into the trash can. And then how we're seeing the probiotics is replanting the garden and making everything grow. And then we're putting mega mucosa on board to condition everything. And there's one more product that is in this line, Mega Pre. I'm not sure if you've used that with people, but I will say that maybe this is because we base things sometimes off our own experiences, and I try not to do that with every patient, certainly because my gut in my case is not everybody else's. But I always forget about Mega Pre, but I've always heard that's such a fantastic product too. It's a prebiotic, and it actually did make me really bloated when I started to baby step and try to add that in. So I haven't really added that back in for myself at all, but I have used it on some other patients who seem to be doing really well, and I'll add that prebiotic into it, which
Yeah, it's
prebiotics
got
sounds so
ki
scary to SIBO patients.
I know, right? It's got like kiwi and I can't remember, maybe
Yeah.
GOS.
Yes, something
Yeah.
like that. Yeah.
So you tried it, so that's not really been part of a
It
protocol for
hasn't, it hasn't. And I sometimes honestly forget about it because I haven't been using it for patients, but it's something I should bring back in. And I've been mindful to bring it back in and just really, whenever something doesn't go well for us, we're trying to just, with SIBO, I don't want to do that anymore. And I should bring it back in for myself and
But
try
you
it.
know what? This is what's really amazing to me about this protocol that worked for you. Oh, and by the way, so about how many patients does it, percent of patients does it work for you?
I would say I actually, when I have those mild to moderate cases, this is what I'll start with now.
Yeah.
If they don't respond, I'll pull back and do some herbal antimicrobials or go with Xifaxan. Xifaxan, as we know, is just hard to source and access
Yeah.
sometimes, especially shipping costs and everything now, even too. So I will hesitate to go with that initially and the timeline because I can get people started on probiotics quicker because they're not waiting for a couple weeks for treatment if they're ordering Xifaxan from a Canadian pharmacy, for
Yeah.
example. But I would probably say over half, like
Great.
60 to 70% of patients who I'm seeing who I might try on this,
Fantastic.
I
Okay.
would probably have a good response.
So, what I was going to say is that what we hear from most of our colleagues who are microbiome experts, like Dr. Jason Horlak, who I have constantly giving master classes for my group, is that prebiotics is really the way to change the microbiome, heal it, and affect it. Your example is just with probiotics. And there are many, even experts out there that say probiotics really can't do the job fully. You need the prebiotics, but it worked for you. This is amazing. And it's working for 60 to 70% of the patients that you're trying it with. So this is amazing. Now, if we think about studies, we have phenomenal studies with probiotics and SIBO, which honestly, for most of us practitioners, we haven't been able to match the effect of these studies. I mean, there are studies that, like pretty much in your case, that just treated the SIBO, nothing else needed, no herbal antimicrobials or anything. Many of us practitioners have had a hard time replicating those results, even if we use the same probiotics used in those studies. But the studies are across the board. They use these because these are spore and yeast
Yeah.
based probiotics. There are studies with spore probiotics showing excellent results. Same with Lactobacillus bifidus, same with Saccharomyces boulardii, all showing excellent results. So we do have study proof that probiotics should work, right? Of course, nothing works for everybody, but here you are a perfect example, you and this protocol, that it has worked.
Yeah, and I'm getting some prebiotics now, probably like inulin. I mean, I wouldn't have touched inulin 4 years ago. You would have had to pay me to put inulin in my body because it made me so bloated.
But this is through your diet, of course.
Yeah,
And
exactly.
so
And
I
I wasn't,
neglected to mention, of course, now
yeah,
you are getting
those,
prebiotics in your diet.
yeah, but I would steer clear of any protein bar with inulin or anything like that in it. And I now probably eat a protein bar just to help support the caloric load I need for and protein load I need for breastfeeding. And it has inulin in it, and I eat one every day. And
So I suppose an argument could be made because as your diet expanded, you probably were getting prebiotics through food. And of course, like Dr. Horlak prizes food probiotics over supplemental probiotics.
it's
So
all that.
maybe I misspoke there that you
Yeah.
are getting prebiotics.
Yeah, but not in the dose that it would be from a supplement. And that's where maybe to continue to condition my gut, I keep thinking and I just forget it. It's in the back of my head that I should try to add that mega pre to, and baby dose it and see what happens. Like, what's the worst that could happen? I feel a little bit bloated. I don't think it's going to send me into a full SIBO relapse at this point. And I shouldn't act like it's not always on my mind. Like, having had SIBO for over a decade and still having it as a chronic relapsing condition, it still feels vulnerable to eat food and continue to expand my diet. And mostly it's when I'm aware that I'm stressed out. I'm always like, oh, am I going to flare? And so it's always part of something I think about with food and nutrition, but it
Right.
doesn't dominate my days anymore.
But I still think it's just, I mean, right, this is amazing. You might have that little worry in the back of your mind, but look at this is amazing. I mean, you're prokinetic, you're off your magnesium for, and have been for years for constipation.
Yeah.
You're only doing megaspore ongoing, and then now in vulnerable times, you're adding in the megamucosa. I mean, it's an amazing success story.
I think my gut was depleted, honestly. Like, and it's SIBO herbal antimicrobials and things, they're so helpful. And they were so helpful to me for a period of time. And I still wouldn't hesitate to use them. If I had a full flare, I would certainly consider them as something I'd do again. I might run right back to Neem and Alamed. But I think my gut was almost just depleted. Like, I
Mhm.
think it was a barren land. And that's why I was reactive to everything.
Yep.
And I just needed to rebuild that garden. Like,
Mhm.
it was like my gut was like the Alvord Desert, the southern eastern part of Oregon, and I needed to make it a big, robust garden again. And I'm still working on that, but that's what it almost felt like, continually using these antibiotics and antibiotics because I didn't know anything better. That's
Right.
because it was my crutch for so long.
Right.
Yeah.
Well, thank you so much for telling us the story of something better we can try.
I hope
So
to somebody, hopefully.
tell everybody how, again, how they can find you if they want to connect with you.
Yeah, gosh, I wish I had maybe some fancy social media platform or whatever, but it's something always in the back of my head. But I'm at Merit Health and Wellness. It's a private but insurance-based clinic in Portland, Oregon. We have our website, which is Merit, two R's and two T's, merithw.com. A lot of my other colleagues work in a similar capacity that I do, or gut stuff or other related conditions. And we're really primary care. It's hard to find primary care that has a functional medicine focus in a lot of cities. And I'm not taking new patients right now because I'm on maternity leave until January. And I'll probably see how my first month or two back goes and the flow, like I said, to protect my boundaries and my gut health. And then I usually take one or two new patients every week. And I'll probably start that again, maybe back in April or March or something like that.
Lindsay, do you do telemedicine? Can people work with you from distance?
Yeah. Yeah. But they have to be with our licenses and the way our practice is set up. Patients have to be in the state of Oregon. And we're not taking new cash pay patients right now. That's just the choice of our business manager. We take a lot of insurances though, and that's listed on our website.
So if someone wants to work with you, they actually need to live in Oregon. They
They
can't
need
be
to
from
live in
another
Oregon.
state.
Yep,
Okay,
at least right now, unless we expanded to taking more just cash pay people.
I see.
I've
Okay.
thought about getting a license in Washington or other close by states to us, but it's just time to go do it as a busy person right now because I do a lot of like virtual around Oregon, like menopause care and stuff too, where you don't necessarily have to have an exam or be in person. Yeah.
Okay. Gosh, thank you so much for sharing your story. I mean, this just gives hope to so many of us. So,
I
any
hope,
other final words you want to say?
don't be afraid to try. Like I said, I was so terrified of probiotics. I was so terrified of that instant bloating, and work with a provider, or don't be afraid to try something new because sleep is hard, and but it doesn't have to dominate your life.
And
Yeah,
total success for you here. Thank you again.
absolutely.
Okay, we did
I hope
it.
that was okay. There's a lot to share.
That was fantastic.